Welcome to MLT 101, Unit 1, Lesson 1. My name is H.M. Barnes, and our lesson objective is to demonstrate an understanding of clinical laboratory science. This is a review and will not be a word-for-word match of your student guide. Our topic objectives today are to describe the various clinical analysis areas of the laboratory and the types of procedures performed in each area, and to describe the different levels of personnel found in the clinical laboratory. Our purpose for laboratory testing is for health confirmation, to establish a diagnosis, evaluation and monitoring of our patients, and the sections of the laboratory include hematology, where we test for diseases of blood and blood-forming tissues, and the complete blood count is the most common test performed. Coagulation, which is used to discover, identify, and monitor defects in the blood clotting mechanisms. The most common test for the coagulation bench is the prothrombin time. We use it to monitor warfarin therapy. We also use the activated partial thromboplastin time, APTT, to evaluate heparin therapy. The chemistry bench is where the majority of your tests will be performed. It's commonly referred to as the bread and butter of the laboratory, along with urinalysis. Tests can be performed individually or, as is often the case, in a panel. Most modern chemistry instruments are computerized. They are fairly automated, meaning you're going to take your tube, you're going to set it on that machine, it's going to scan the barcode, look at your patient's record, and run most of the tests automatically based on what the doctor's ordered. Next up, we have serology and immunology. These are often referred to and thought of as a pair. We're going to be primarily testing serum. We're going to be looking for the development of antibodies or the presence of antigens. We're also going to be looking for autoimmune reactions. In urinalysis, also referred to as UA. It is commonly combined with hematology or chemistry, depending on how big the lab is that you're working in. Along with chemistry, it is one of the busiest areas of the laboratory. And routine testing is going to include physical, chemical, and microscopic analysis of urine. One of the more fun areas to work in the laboratory is microbiology. In microbiology, it's common to perform a culture and sensitivity test for microorganisms, usually bacteria, which is going to help a physician prescribe a proper medication, think antibiotic here, that will work to kill a particular bacteria. Due to antibiotic resistances, you can't just throw antibiotics at bacteria and think it's going to work. Nowadays, we have to figure out exactly which medication will work to cure which infection. It may also be paired with other benches to include parasitology, mycology, and virology. In my personal experience, I've seen microbiology paired with immunology and serology. I've also seen it paired with molecular diagnostics, which is laboratory speak for genetic testing. Related to and often physically located in the laboratory is histology. This is a separate specialty from MLT. Being qualified as a medical laboratory technician does not directly qualify someone to work as a histology technician, and vice versa. Although we often work side by side, if not in the same room, in offices directly adjacent to each other. You'll get to know your histo team very well. Histology will study microscopic structures of tissue, and their most common diagnostic techniques are biopsies, where a small piece of tissue is obtained from an organ, and frozen sections, freezing and then examining a sample. Histotechs are going to spend a lot of time preparing and staining slides to be analyzed by the pathologist. which means there's a very high chance they're going to know your lab director better than you do. because your lab director will often be a pathologist. Next up, you have cytology. Some of the cytotechs I've known are also certified as lab technicians, and during their downtime would work in the lab alongside the other lab techs. But like histo, cytology is a separate and distinct specialty from general medical laboratory technician. Cytologists are going to study the structure of cells, they're going to diagnose malignancies, and their most common exam is to perform a pap smear. The last bench we have is cytogenetics, which is used to identify chromosomal deficiencies and test for genetic diseases. Common tests in cytogenetics include DNA histograms and DNA fingerprinting. Our next topic objective, we are going to describe the different levels of personnel found in the clinical laboratory. At the top of every lab, you've got a lab director or pathologist. This is a position that is mandated in the Code of Federal Regulations for the United States, and you're going to have somebody filling this job. They are going to manage your lab along with, commonly, other administrative personnel. It's a lot of paperwork to manage a medical laboratory and is usually too much for one lone individual to do, especially if that person is also your lab's pathologist, which is often the case. Your laboratory director may be a pathologist or one of your more senior clinical laboratory scientists with a minimum of a bachelor's degree. A pathologist is a physician who specializes in diagnosing diseases. For those of you that are new to medicine, the easy way to think of them is if your medical laboratory technician is a Charmander, your medical laboratory scientist is a Charmeleon, your pathologist is your Charizard. They are the final form of the medical laboratory science career path. However, it is a separate educational program and a person has to go to medical school to become a pathologist. You will also have your laboratory administrator or lab manager. It is usually a medical laboratory scientist or medical technologist. Those are equivalent certifications. They just come from different accrediting agencies with an advanced degree and experience. They're going to oversee the operations, including physician and patient services. Depending on your clinic or hospital, they may also supervise other ancillary services like radiology and respiratory therapy. Working alongside your lab administrator or lab manager, you're going to have your technical supervisors, commonly referred to as a bench supervisor. They're going to supervise and administrate a section or subsection of the lab. While your lab may have an overall lab manager, you'll have a technical supervisor for the chemistry bench. That person will be in charge of everything that happens in chemistry. It's usually an extremely busy position. They report directly to the lab administrator and will often have additional education beyond just the standard medical laboratory scientist certification. The next position you'll have in your laboratory is a medical technologist or a medical laboratory scientist. Again, those are equivalent terms. Functionally, they are identical. It's just the name for certifications from different accrediting agencies to do the same job. It requires a bachelor's degree plus study in a medical lab program. Some states require that you have an MT or MLS license, but not always. Responsibilities will include your advanced testing, reporting, quality assurance, evaluating new procedures. That is a very time-intensive and tedious process, and instrument maintenance. If you're new to the lab, your medical technologists or your medical laboratory scientists are often the closest at hand, experienced senior people that you can ask questions to. Next, we have the medical laboratory technician, often but not always holding an associate's degree. Some states require a license for an MLT, a medical laboratory technician. Off the top of my head, I can tell you that California and New York, I believe also Florida, require specific state licenses as well. You get a national certification and then a state-based certification. The states that require specific state-based certifications will often pay you better. They're responsible for routine tests, equipment operation, and maintenance. An old position that I personally have never been able to work alongside due to just not being a position at the hospitals and clinics that I've worked at is the clinical laboratory assistant. It's an older position that is being revived. Often it's someone with phlebotomy experience. They've got skills in specimen processing and basic laboratory testing, and is a generalist who will assist the MLS or MLT. Often, very commonly, your lab is going to have phlebotomists. Sometimes you will have MLTs or lab assistants performing phlebotomy. But also very common is you will have a dedicated phlebotomy team. These are people who have gotten a phlebotomy certification and are qualified to collect blood. A high school diploma is required for formal college programs in phlebotomy. If you are studying for an MLT, your MLT certification will also qualify you to perform this procedure. The national certification is done through an examination and is usually much faster to acquire than the MLT certification. Being a phlebotomist does not qualify somebody to perform the laboratory testing that the MLT would normally be performing. Other lab personnel may include programmers, people that are trained to work on your laboratory information system, also known as the LIS or LIS for short. You may have somebody who's dedicated to manage that system. Quality assurance managers. At my first lab, the quality assurance manager had the largest office in the entire lab, even bigger than the lab director's office. This was because our quality assurance manager maintained what was effectively a library full of binders of quality assurance records and needed the space to perform the job. You will also have point of care testing supervisors, which may or may not be an MLT or MLS person in your lab.